Today I'd like to talk about the numbers that you may be seeing that are coming from Klamath County Public Health in regards to COVID-19. A lot of people are wondering, where are those numbers coming from? Where are people contracting COVID-19? And we're not in the business of saying this person got it from a barbecue and this person got it from a wedding and this person got it from a birthday party. What we do know is that a lot of these cases can be traced back to a source, meaning we know where it came from. So when you want to know where cases are coming from, and if we know if they can be tracked to another source, there's a really great metric online on the Oregon Health Authority website that will give you an idea if we do know where they're coming from. The metric is called the percentage of cases not traced to a known source. So what that means is when we do our contact investigations, we ask people who they've been in contact with. And when that happens, we then actively monitor those contacts to see if they too develop symptoms. And oftentimes they do. But it's very rarely a random case of I went to the grocery store and I got COVID-19, because people are doing really good jobs at distancing, washing their hands and wearing their masks. But high risk comes from when you live with someone who's COVID positive. So a lot of times we are able to trace back where somebody got COVID-19 because they're a household contact, they were a close friend and they were at a social gathering together, or maybe they work in close proximity to one another. That's why it's important that we continue to keep our distance from people, wash our hands, wear your masks when you can't, keep your distance. We're really not in the business of saying somebody got COVID-19 at their friend's barbecue or at this particular wedding, because at the end of the day, we're able to show through this metric, yes, we know where they got it, and that's why it's important to keep your distance. In addition, some people get very concerned when we see some high numbers. For example, recently this week, we saw 13 cases get announced in one day, and people think, I gotta be on high alert. And we just want to explain to you that sometimes there's a backlog in the labs, and so we may not get lab results for a few days and then all of a sudden we get a bunch at once. Or it might be something that a household has several people in it and they all ended up getting symptoms, and then we ask them to all go get tested. And so we're testing the right people, and therefore we are seeing some higher numbers, and that's to be expected. What we want you to know is we don't want you to be afraid, but we do want you to be cautious. So if you want to protect yourself, follow the guidelines that we've been saying. Distancing, washing your hands, sanitizing high-touch surfaces, wearing a mask when you can't, keep your distance from others. But what we want you to know is every day is a new day. We get different numbers, different case scenarios every day. So when we have those metrics, we might be meeting them one day, we might not be meeting them the next. Again, that's to be expected, but we're trying to keep you as informed as possible.